Hello everyone, my name is Luke Elijah. Thank you for watching this video. I'm with Dr. Jason Siefferman, who is the Medical Director of the Manhattan Pain Medicine, which is located at 25 Fifth Avenue in Manhattan, New York. Thank you, Dr. Siefferman, for agreeing to come on my talk show.
Well, thank you.
Right. Dr. Siefferman, you are a specialist in pain rehabilitation and physical pain treatment. Could you tell us a little bit more about your history and background, how you got started becoming a doctor specializing in this field?
Sure. Well, I always had an interest in health and I enjoyed problem solving. And rehabilitation medicine gives you an opportunity to help people solve problems. After an injury or some sort of pain incident, you have a lot of obstacles to come over. Your life changes, you have to find a way to get back to work, you have to change your relationships with family, things change. So there are lots of problems to overcome. Some are very practical and you help them logistically with things like that, and others are more medical. And we deal with all of that in rehabilitation medicine.
Right, that's very good. We need more healers and people like you to assist and aid people with all these kind of different problems. And you're like, in a way, a problem solver. Could you give us an example of a successful client that you help to treat and get back on track?
Sure. So often I see patients when they've been to many other doctors. I had one particular gentleman who was still working in his 60s. He had severe neck pain for many years. He had had multiple surgeries, lots of opioid pain medication, and still lots of pain, and he was no better off after all of this. So we came up with a plan together where we worked to get him off the medications. We did a few specific neck injections, and after a couple months he was off the medications, his pain was controlled, he was back to work and doing very well.
That's fantastic. What would you say is the kind of ideal client or patient to come see you? What kind of problems can you treat?
Well, anyone with any sort of pain or disability. I cover the breadth of that. I see a lot of patients with headache, with neck pain, back pain, sports injuries, even after stroke or spinal cord injury.
So is it any age from infant all the way to elderly senior?
So I was trained in treating children with cerebral palsy and things like that, but most of the time I'm treating adults. I see a lot of younger adults with neck pain, back pain, just because of a sedentary lifestyle. They're at a desk job using a computer all day. Of course, your neck starts to hurt, your shoulders get stiff. And I also see older patients who have, like I said, had multiple back surgeries and they're still in lots of pain and nothing seemed to work. So the gamut, really.
Yeah, it runs the gamut, huh? That's awesome. Could you tell us, you actually also do aesthetic medicine, right?
Yes.
You do fillers and Botox. Could you share with us how is it that someone who is specializing in pain medicine has also an interest in creating and doing aesthetic services, catering to this market as well?
Sure. So as a pain management specialist, I'm trained in delivering precise amounts of medication to very specific locations. So doing spine injections, for example, you want to be very precise with where you put the medication. With aesthetics, it's similar. I'm trained in botulinum toxin for stroke, spasticity, movement disorders like cervical dystonia, and for chronic migraines. And a lot of that covers with the facial anatomy. And treating these muscles for a cosmetic outcome, well, you actually have to do that when you're treating them for pain disorders as well.
Anyway, right?
Otherwise, they end up looking a bit odd, and nobody wants that. So doing that, adding in the fillers for a bit more boost, right? It's not a far stretch, and really, it's just the cosmetic eye, knowing the facial anatomy, knowing where to place the medication so that you get the desirable outcome, and then speaking with the patient, finding out exactly what they want, and creating that for them.
Right. There's a lot of misinformation and ignorance around the subject of botulinum toxin. People think that Botox is going to paralyze the face and make them have a frozen look. Could you give us some advice and tips, like what can they do to educate themselves and even prevent such an undesirable outcome?
Sure. But botulinum is an extremely potent toxin. That's why we use it in very small doses. And you have to know what you want. If you want to be completely frozen, I can freeze you. I'm happy to do that, right? If you want to look like Jack Nicholson, I'm happy to do that, right? But most people don't want spot eyes.
Yes.
So, we talk about what you want. When you come in, you say, you know what, I have these wrinkles on my forehead, I still want to be able to raise my eyebrows, but I don't want these wrinkles to be so strong. So we come up with a plan for that.
So you can actually just do a reduction, so it still look very natural as if you never did have any Botox at all.
Right, you don't want to look overdone.
Yes, yeah. And botulinum toxin is safe, for the record, right? Dr. Siefferman, can you tell us, how is it that, someone who also majored in music in college also became, and you decided to follow a route that the medical route instead, you became a professional doctor instead. How is it that you balance, how do you balance these two aspects of your life, the creative, artistic, expressive aspect as well as the technical, scientific aspect?
But I think as humans, we all have multiple aspects to our life. You know, we're not one-dimensional people.
Yes.
So we all have interests that are in different areas. So, you know, I knew going to college that I wanted to go into medicine, and I studied music because that's a passion. You know, I grew up with music and I always wanted that to be a part of my life, and I wanted to learn more about it. And, you know, we find outlets for our creative aspects and our intellectual aspects, and we build our lives around these things.
Right, wonderful. We're glad that you are a doctor instead, because I think you've served and helped a greater portion of the community doing what you do. We need more healers like yourself, And so yeah, the fact that you sing, can sing for your clients and patients is a bonus. It's a nice bonus. Well, thank you, doctor, for your time, and we wish you much success in your future career.
Thank you.
And we hope to see you again in one of my future videos. But how can the audience contact you? Where can they go to find out more and to hire you for one of your services, or to get a consultation, or to hear you sing?
Oh my goodness. All right, I have a website, manhattanpainmedicine.com, or you can schedule through ZocDoc.
I'll be placing these links below, so feel free to click on it and find out more for yourself and come for a consultation with Dr. Siefferman, right, for all your pain needs as well as your aesthetic needs. Right, you can do Botox, fillers, and what else do you do other than Botox and fillers?
And pain management. We also do
chemical peels.
Chemical peels. Yeah.
Okay, so of your rejuvenation needs, he's the person to go to. Okay, thank you, doctor, again for your time and for your expertise. We had a good time chatting and listening to you. So thank you guys for watching this video. Please feel free to subscribe to my YouTube channel for more videos.